For many years, the infrastructure of Grady had been neglected, and our patient record was basically paper.
It was difficulty finding information, and we had a lot of issues regarding date, time, legibility.
The systems was very manual, very paper-based, very fragmented.
It didn't have the ability for everyone to see the complete health record in its entirety.
There was very little connectivity between the different parts of Grady.
So in order for us to really deliver better care, more efficient care, we needed an electronic record that everyone could use.
We saw this as an opportunity to really transform what we were doing at Grady and how we take care of patients.
Epic is an enterprise electronic health record which covers every area of a hospital or medical center.
It helps us maintain patients' individual health information from a provider, from a taking care of the patient standpoint, and from a medication use standpoint.
Well, the Big Bang means that we brought large parts of the health system live all at once.
What we were able to do was roll out all of our clinical and revenue applications in about 14 months in one shot, part of one Big Bang go live.
I think the Big Bang approach worked very well for us. It was everybody into the water at once and making it work, and I actually think it created a lot of camaraderie, a lot of teamwork among the various disciplines.
Nursing played a major role in implementing Epic. In fact, nursing was at the table, if you will, from start to finish.
A comparable implementation at other hospitals has averaged about 6 years in length, so we were excited to bring a great deal of change to the organization in a relatively short period of time.
We've seen so many improvements since we went live with Epic. One of the most powerful things we've had is we now get alerts whenever our patient get admitted, either for a procedure or for some illness or something that's going on, and that is amazing.
The benefits of Epic for the Imaging Services Department, it allowed us to see the patient's chart and also interface our PACS system with Epic, whereby you can also export to the images directly from the patient's medical record.
Epic has really transformed the way we run our ED. Like I mentioned in the past, we didn't know exactly how many patients were in the emergency department at any point in time, and we didn't know how long they'd been here. Now we have an instant record of exactly who's here, how long they've been waiting, and what they've been waiting for.
Epic has drastically improved not only the care that the patient received, but by implementing bedside medication verification system, once the nurse actually scans the patient barcode on their arm, it immediately pulls up the patient's medication profile. This in real time tells the nurse what medications the patient is on. Then the nurse scans the medication. We are able to capture all of our costs. Also, we're able to immediately document that the medication was given. It has eliminated probably about 15 steps that the nurse, pharmacy, and physician had to do in the past just by now scanning the patient and scanning the medication.
Our systems were streamlined. We have access to information before that was very hard for us to quickly put our hands on, that now we have immediate access to. The process for communicating medication orders on the inpatient side, or really outpatient prescriptions to the pharmacy, now is electronic as opposed to a paper-based system.
The Big Bang was a huge effort. The momentum actually hasn't stopped since. It was just a couple of weeks ago we brought live this functionality called Care Everywhere that actually gives Grady the ability to exchange patient data with other hospitals.
If a patient comes from California, gets in a car accident, we can get their information from the Kaiser Hospital immediately. This improves patient care tremendously because they may not be able to tell us what the patient history is, what medications there are, yet we know that almost instantaneously.
We're actually one of the first hospitals in Metro Atlanta to be able to do this, so it's a great advancement for Grady.
Without our strong and dynamic leadership team, without the unwavering support of our clinical staff and our board, and without a significant transformation of our network, Epic wouldn't be a reality at Grady today.
So I really think Epic has propelled us into the next century.
The future is extremely exciting, what we can do with this product.